do not anticipate a change in the MMR vaccine. ACIP is an independent panel. So
well, it's a panel you just put those folks on. Far from what you said, they're people with ideas that are completely outside the mainstream.
You mean out of the pharmaceutical paradigm?
Let me just say, Mr. Secretary, all these vaccines that we're talking about today are free and accessible to parents today in America who have the freedom to be able to make that choice for their children. Will that be true after your handpicked panel makes their judgments about these vaccines?
I think that parents should be free to...
I know you said that before. I do too.
To make their own choices.
So will they be just as free after these?
I assume they will be.
I will hold you to that, Secretary Kennedy. Because this is not a podcast. It is the American people's health that's on the line here. This is the last thing, by the way, our parents need when their kids are going back to school, is to have the kind of confusion and expense and scarcity that you're creating as a result of your ideology. I think it's critical for you to share the evidence that this panel will rely on. Will you give the American people 6 months or 6 weeks in advance the record that they're going to rely on to make these decisions? Will you make it transparent for the American people?
All the evidence is transparent.
Will you make it in advance transparent for the American people so they can comment on it?
All the evidence is transparent for the first time in history, and you were never there complaining when the pharmaceutical companies were picking those people and then running their products through with no safety testing.
You can characterize it any way you want. I quoted them today. What I said was accurate. What you said were lies. You described people moving the Titanic.
Are you saying that the mRNA vaccine has never been associated with myocarditis or pericarditis in teenagers?
I am simply.
Is that what you're trying to tell us?
I am simply trying to say that the people that you have put on that panel, after firing the entire.
You're evading the question.
No, I'm asking the questions here,
You're
Mr.
evading
Kennedy.
that question.
I'm asking the questions,
I
Mr.
asked
Kennedy.
you a question.
I'm asking the questions for Mr. Kennedy on behalf of parents and schools and teachers all over the United States of America who deserve so much better than your leadership. That's what this conversation is about, Mr. Chairman.
Senator, they deserve the truth, and that's what we're going to give them for the first time in the history of that agency.
Mr. Secretary, I agree with a lot of my colleagues' statement. I actually had hoped, I didn't support you. I thought taking on chronic illnesses was going to be important. I've got 2 kids, as we discussed when you met, that have chronic illnesses. I'm not sure that the focus on red dye and seed oils are going to fully solve that problem.
Of course they won't.
I would say this, that seems where your emphasis is. I want to go back to just, again, some basic facts. Do you accept the fact that 1 million Americans died from COVID?
I don't know how many died.
You're the Secretary of Health and Human Services. You don't have any idea how many Americans died from COVID?
I don't think anybody knows that because there was so much data chaos coming out of the CDC, and there was so many perverse incentives. And these are model studies.
You don't know the answer of how many Americans died from COVID. This is the Secretary of Health and Human Services. Do you think the vaccine did anything to prevent additional deaths?
Again, I would like to see the data and talk about the data.
You have had this job for 8 months, and you don't know the data about whether the vaccine saved lives?
And that's the problem, is that they didn't have the data. The data by the Biden administration, absolutely dismal.
So who is politicizing? You're saying the Biden administration politicized all the data? Go back to what Senator Cantwell just said.
They fired Dr.
Go to the Trump Surgeon General.
They fired Dr. Krauss. They fired all the people who questioned the orthodoxy. They fired Dr. Gruber, Dr. Krauss.
So, Mr. Chairman, the Secretary of Health and Human Services doesn't know how many Americans died from COVID. Doesn't know if the vaccine helped prevent any deaths. And you are sitting as Secretary of Health and Human Services? How can you be that ignorant? Like, I remember when we went through the hearing with you, I asked you about community health centers. You didn't know what role they play. I've been visiting community. I'm glad you got to one, I think in April. I tell you what I hear on community health centers, they are terrified, with all due respect to my good friend, the chairman, of the big awful bill, because they are going to lose health care across the board. They already live in food deserts. They can't get to a nutritionist because Medicaid doesn't do enough reimbursement. If you're going to want Americans to get healthier, should they have access to nutritionists? Should they have access to good science about healthy food?
Absolutely.
Well, then how is that going to happen with the Medicaid cuts that are taking place?
There are no cuts to Medicaid.
Sir, that is an absurd. There is not a single, some of my Republican colleagues, but there is not a single study that does not, and I can tell you, I was in Franklin, Virginia a couple days ago. The rural hospital is going to close. The hospital system was so afraid they wouldn't even let me have the meeting there. But that rural hospital is going to close. And they are looking for where those folks are going to go. I mean, you're supposed to be doing health care policy, not being the doctor in residence for all of America. I hope I can just say, I'm still going to trust my doctor rather than your health advice.
That's the problem with our thing.
And obviously, Tom Cotton's going to, who knows who he's going to trust. But let me go back to policy for a couple, so maybe we can lower the temperature a little bit. I got a bipartisan bill that would be a systemic fix, not a vote-buying mechanism when Medicaid's getting cut, what was put in on the rural hospitals. One of the things we could do, Mr. Secretary, is make sure that the folks who work in rural hospitals get an 80% reimbursement of what folks get in more urban centers. Would you support that legislation?
Are you talking about the area wage index?
I'm talking about the area wage index and moving that up to 80%, so there is actually ability to get rural providers.
President Trump supports that, and we support
You support it. Good. So you will work with us to get that passed.
Yes.
That will increase costs on both Medicaid and Medicare, so you are committed to that. I appreciate that. What about Senator Wyden and I've got a bill, because across America,
what about what?
hospitals are shutting down on their OBGYN services. Try to have a baby. I don't know about in all of my other friend states, but in Southside Virginia, you can't find a hospital. Will you work with us to make sure that before OBGYN services are taken out of a rural hospital, there has to be a process and procedure?
I'm happy to work with you on that, Senator, meet with you and see if we can work with you on it. I don't know exactly what the issue is.
Well, again, the Secretary of Health and Human Services, who has said he doesn't know how many people died from COVID, doesn't know if the vaccine saved lives, doesn't understand the issue that OBGYN doctors are fleeing rural America because they can't afford it. And with the cuts that are coming up, it's going to be exponentially worse. I would invite you, sir, to come with me to a community health center in Virginia and hear what is on people's mind.
Last November, while you were under consideration to become Secretary of Health and Human Services, Mr. Kennedy, you said, quote, if vaccines are working for somebody, I'm not going to take them away. No exceptions, no ifs, ands, or buts. You would not take away vaccines from anyone who wanted them. Then last week, you announced that the COVID-19 vaccine is no longer approved for healthy people under the age of 65. In announcing the change, you said the vaccine will be available for anyone who wants it. Now, obviously, both things cannot be true at the same moment. So let's clear this up right now, Secretary Kennedy. Will you tell America that all adults and all children over 6 months of age are eligible to get a COVID booster at their local pharmacy today?
Anybody can get the booster.
I'm sorry?
Anybody can get it, Senator.
Anybody. So you're saying that is now the official rule of HHS. Anybody is eligible to get a booster by just walking into the pharmacy.
It's not recommended for healthy people.
No. If you don't recommend, then the consequence of that in many states is that you can't walk into a pharmacy and get one. It means insurance companies don't have to cover the $200 or so cost. As Senator Dr. Cassidy said, you are effectively denying people vaccines.
We're not going to recommend a product for which there's no clinical data for that indication. Is that what I should be doing?
What you should be doing is honoring your promise that you made when you were looking to get confirmed in this job.
You're going like this.
And that is, you promised that you would not take away vaccines from anyone who wanted them. You just changed the classification of the COVID vaccine.
I'm not taking them away from people, Senator.
It takes it away if you can't get it from your pharmacist.
Well, most Americans are going to be able to get it from their pharmacy for free. Most Americans will be able to get it from their pharmacy for free.
The question is everyone who wants it. That was your promise,
No, I didn't. I never promised that I was going to recommend products for which there is no indication.
When you said...
And I know you've taken $855,000 from pharmaceutical companies, Senator.
Did you hold up a big sign saying that you were lying when you said that? Because you are the one who said you would not take them away. Now, Senator Kennedy,
I'm not taking them away from anybody.
Secretary,
you want me to indicate a product for which there is no clinical data?
Senator,
is that what you want?
Secretary Kennedy, you said you wouldn't, and now you did.
I'm not taking them away. Everybody can get access to them.
No, they can't walk into a pharmacy the way they could last month and get access.
It depends on the state. It depends on the states.
A year ago,
but they can still get it. Everybody can get it. Everybody can get it, Senator.
So look, let's move on. You clearly are taking away vaccines. I've seen the list for what's coming up next, and that is the agenda for the next CDC vaccine panel. And first up is ratifying your COVID actions. Second is hepatitis B is on the agenda. So should Americans expect you to take away hepatitis vaccine access as well, even though you promised not to?
As I said, I'm not taking vaccines away from anybody.
Okay, same answer, right? You're just going to deny that when people can't get access, that you're not taking it away. Then let me ask you, is that the same game you're going to play with me?
You want me to recommend every product in the world?
No,
so that without any clinical trial data.
Through on your promises.
Yeah, my promise was to give.
A month ago, we could get COVID vaccines by just walking.
You can still get COVID vaccines, Senator.
You are taking that away.
No, you are still. You can still get the COVID vaccines, and Medicare will still pay for them, and Medicaid will still pay for them.
Tell the head of the CDC that if she refused to sign off on your changes to the childhood vaccine schedule, that she had to resign.
No, I told her that she had to resign because I asked her, are you a trustworthy person? And she said no. So if you had an employee who told you they weren't trustworthy, would you ask them to resign, Senator?
So I'm sorry, but this is not what she has said publicly. She has said
I'm not surprised about that.
So you're saying she's lying?
Yes. Every conversation I had with her, there were witnesses. And let me get
this straight. This is the same person that less than a month earlier, you stood next to her and described her as unimpeachable, and you had full confidence in her, and that you had full confidence in her scientific credentials. And in a month, she became a liar?
Yeah, you should ask her what changed. And by the way, a month ago, you were voting against her. Oh, because you thought she was either incompetent, ineligible, or unsuited to the task.
I voted against her because I was afraid she was going to bend the knee to you and Donald Trump. And it looks like she didn't bend the knee, so you fired her. Look, you're putting America's babies' health at risk, America's seniors' health at risk, all Americans' health at risk, and you should resign.
I think that Secretary Kennedy is dead set on making it harder for children to get vaccines and that kids are going to die because of it. And Mr. Chairman, I'd like to put in the record today an op-ed written by Susan Monarez, who was fired by Mr. Kennedy.
Without objection.
So what we know, and Dr. Monarez, was approved by Republicans. She wrote an op-ed today in the Wall Street Journal, which I've just put in the record, and I quote her. She said, "I was told to pre-approve the recommendations of a vaccine advisory panel newly filled with people who have publicly expressed anti-vaccine rhetoric." So this is not some liberal philosopher or something. This is the CDC director who tells the Wall Street Journal, which is not exactly interested in progressive, theories and the like, that she was told to pre-approve the recommendations of a vaccine advisory panel filled with people who've publicly expressed anti-vaccine rhetoric. So my first question, Mr. Secretary, is did you in fact do what Director Monarez said you did, which is tell her to just go along with vaccine recommendations even if she didn't think such recommendations aligned with scientific evidence? That is
No, I did not.
That's a yes or no. So you have an opportunity to call her a liar if you say that you didn't do it, but I'd like to see you respond to this.
No, I did not say that to her. And I never had a private meeting with her. So there are witnesses to every meeting that we have, and all of those witnesses will say, I never said that.
So she's lying today to the American people in the Wall Street Journal?
Yes, sir.
Okay.
Do you think the women on the steps of the Capitol were a hoax yesterday?
I don't know about any women on the steps of the Capitol.
The women who
yesterday.
were talking about Epstein, do you think they were a hoax yesterday?
Do I think they were
Do you think they were perpetrating a hoax yesterday?
perpetuating a hoax?
Yeah.
I have no idea what they were saying. This is the first I'm hearing about it.
You're hearing about the women on the Capitol steps saying that they believe that the Epstein information should be made public? That's the first you're hearing about it? What I'm saying is you are perpetrating hoaxes. You, as this Secretary of Health, so you're undermining the whole healthcare delivery system, and you keep trying to point to chronic disease, but you're not putting solutions on the table to cover more Americans, and you're taking away the science and technology that has made us the leader that has saved, according to the first Trump administration Surgeon General, millions of lives, and you don't want to keep that going. So no, I don't support your continued efforts as Secretary, and I definitely think that our colleagues need to rally around science. If you want the Northwest to continue to lead on all innovation and all healthy people, okay, we'll do that. But it's a sad statement for the rest of America and America's leadership on technology. Thank you, Mr. Chairman.